It's a clown world in British Columbia. We are still preventing healthy, able, and capable, yet vaccine-free healthcare workers from saving lives in certain medical settings, such as hospitals. And beside me is Aurora. Wait till you see some clips of what happened in a meeting she went into, where she asked the questions you've all been wanting the answers to Provincial Health Officer Dr. Bonnie Henry's employers.
It is commonplace for those who have received their third, fourth, fifth doses to get COVID, even if they've been vaccinated. Surely you can all see that the current strategy is not doing what it was purported to do. So here we are, more than a year later, our healthcare system on the brink of collapse, and the healthcare worker injection mandate continues to be in effect. Despite the vast amount of evidence discrediting the validity of the order, despite every other province in this country and many countries around the world acknowledging this approach is neither scientifically sound nor effective, despite the tens of thousands of COVID-related sick calls all of our health authorities have received after the non-vaccinated healthcare workers were fired and thus not spreading COVID in the workplace. So again, perhaps someone here can enlighten me as to what is different in BC. In this email, I shared under PHSA's whistleblower policy some of the alarming red flags I noticed related to COVID while working as a nurse for PHSA. Namely, the huge discrepancy in adverse vaccine reactions occurring versus those being reported to the public. In this email, an abundance of credible resources were included. I have yet to receive a response from a single one of you. The public health measures, including but not limited to the experimental COVID injection that you have facilitated, promoted, and mandated are causing significant morbidity and mortality in this province. In Pfizer's own post-market trial data, in the first 3 months, ending February 28, 2021, their own data reported several pages of adverse reactions, including over 1,200 deaths. Myocarditis, among other cardiac issues, severe neurological issues, and a horrific rate of fetal demise in mothers who discovered they were pregnant when they received the injection. The increased all-cause mortality and decreased live births have been impacted globally at rates never been seen before, not even close to it. Our healthcare system was already failing before COVID. It is now on the brink of irreparable dysfunction. I, as a nurse, one of the many thousands, am now on welfare and lining up at the food bank every 2 weeks because you continue to uphold a mandate that is not scientifically sound, ethical, moral, or lawful.
I have reviewed your information and I am confident in the evidence the province is using.
I will leave. Shame on all of you for not looking into this. There will come a point in time, and it's becoming more and more obvious.
This is Aurora Bisson-Montpetit. Now tell us how you were working as a nurse before these mandates.
So initially I was working at 811, the nurses hotline, which is under HealthLink BC. And during this time, people would call in, and after the vaccine was rolled out, I would get call after call after call of adverse reactions from people who had recently received the vaccine. I was obviously very concerned about it. I wasn't surprised because I'd been looking into this for quite some time. I had initially tried to raise this concern to my manager and was brushed off. I left HealthLink BC, I think it was around May, June maybe, and then I transferred to Children's Hospital in July, and that's where I was fired from, was Children's Hospital, working in adolescent inpatient mental health, which, as we all know, what this has done to the mental health of everybody, and to see it happening to the kids in this province has been absolutely horrendous.
So I want to flash back just a bit to what you said there. You're getting these calls about these adverse reactions to this safe and effective jab that we were all told about. And then flash forward some months later and you're told you better get this or you lose your job.
I have very little patience for people who aren't immunized in healthcare.
What was that like?
It was horrendous, to say the least. I knew it was coming. I was hoping, obviously, like many of us, that things would change before that point. It was the week before the mandates actually came into effect, and my manager approached me while I was at work and said, you know what's happening. What are you planning to do? And I said, well, I'm not providing you with my personal private medical information. And she said, well, I already know you're not vaccinated. So a complete breach of my private medical information.
Yeah. I think that was something we still haven't completely grasped. Now, one of the questions that people have been asking, including myself over the past months, is how many nurses or doctors or what have you have been laid off without paid or terminated. I recently interviewed another nurse, a former ER nurse, who is also not helping save lives right now thanks to these mandates. She did a freedom of information request to get that number as it pertains to the nurses. Let's just play a clip of that.
I had to be very specific, so I used the dates from November 30th, 2021 until June 30th, 2022. So one of the questions I asked were how many, just specifically nurses, were terminated due to the COVID mandates. And so up until June 30th, there were just over 2,000 that were terminated. There has been more that have been terminated since then as they come back from leaves. And this does not actually cover the numbers that left on early retirement. And so the union actually reimburses nurses $200 on their license fees. We have to pay $700 a year for that. And the union reimburses $200. This year, as compared to last year, there were 4,000 less reimbursements. And we sort of look at that as the early retirements, as most of the terminated did keep their licenses. So we're looking at probably 6,000 to 8,000 less nurses in the system than last year. I also asked how many COVID sick calls there were. So when you are scheduled for a shift and you can't make it, you have to phone into this phone line and it gives you options as to why you aren't going to be able to make your shift. Illness was one. And then when COVID happened, they actually differentiated between COVID illness and regular illness. So in the 6 months, November 30th to June 30th, and only 4 health authorities, because Island Health didn't differentiate for some reason, there were over 20,000 COVID sick calls in double vaccinated nurses. This is just the nurses. I'm not talking about any other healthcare. So 20,000 COVID sick calls. So what you have now is nurses who are sick with COVID, and then you've taken out healthy nurses, and then we ran into critical staffing shortages because there was nobody able to cover all of these nurses. So the COVID sick calls, the terminated, and then interestingly enough, I did ask for numbers of nurses last year versus numbers of nurses this year. Now, each of the health authorities brought up that there was actually a couple hundred more in each health authority of nurses, which I found interesting until I realized that COVID funding from the federal government actually enabled them to hire back a lot of retired nurses for COVID immunizations, contact tracing. And so there was a lot of nurses that were brought on for that, but not necessarily in the front lines. Now, I found it interesting that Adrian Dick said that he has added 38,000 healthcare workers to our healthcare system. And I would like him to produce the evidence for that, because that is not what I found.
So thousands of nurses. Mind you, this is while BC's healthcare system is completely in shambles. It was already on its last legs before COVID, and now it's desperately understaffed. But something Corinne Maury pointed out, and you actually pointed out in that meeting, was that there were the sick calls after you guys were out of the system. What was that about?
Yeah, so after we were no longer allowed to work, there have been tens of thousands of COVID-related sick calls. There's it's called the Earl line, in which employees call in and say why they're sick, how many days they're going to be off. So the province has the data and the numbers saying how many people, and they break it down into regular sickness, COVID-related sickness. So they have all the numbers of how many COVID-related sick calls, how many times these people have been calling in. So we weren't the ones spreading COVID in the workplace. It was all the nurses and healthcare workers who were still at work.
You demonize those like me, stating that we were a threat to patients, the public, and the healthcare system, while you hypocritically ask nurses with active COVID illness to continue working in the healthcare system. Somehow, magically, vaccinated nurses who are sick are not a risk to others, but non-vaccinated nurses who are healthy are a risk.
Kudos to you. I mean, the way you handled yourself was so good. You were just by yourself, but boy, you were mighty. And I don't know what was going through their heads when they were listening to you. What's happened since then? Did you get any solid answers?
No, I still have not received a reply from any of them. I've sent several emails over the last year. The investigation summary, in which I mentioned during the video, I haven't received a single reply from any of them, which is obviously very concerning. It's very interesting because there's a number of lawyers that are actually on the board and the executive, and some of them are actually allegedly human rights specialists. So I find that very concerning, hypocritical, ironic.
Well, human rights only matter if the government says so, right? Now, I also reached out from Rebel News to try to get some of the answers to the questions that you asked. I have not heard back at this point in time, but if I do in a reasonable manner, I will go ahead and update the written article for this report, which you can find in the description below. Thank you so much, Aurora, for being on Rebel News.
Thank you, Drea.
Till the next report, I'm Drea Humphrey with Rebel News. Medical madness continues and the legacy media continues to ignore it. But thankfully at Rebel News, we promise to bring you the other side of the story. And if you appreciate that, you can help cover and help support our independent journalism by donating what you can at rebelnews.com/donate. We appreciate your support.